Welcome to this human coronavirus brief, brought to you by Alphatech Pet Incorporated, your sanitation specialists serving the animal care profession since 1989. I'm Dr. Seitz, the president of Alphatech Pet Incorporated. Are you prepared for the unexpected? During this brief, I'm going to challenge you toward thinking about preparedness in the event we were to experience widespread outbreaks of human coronavirus here in the United States. I'm going to cover the following 5 topics to arm you with information necessary to understand the pathogen and to implement a suitable preparedness plan for your facility. What is it? How is it transmitted? What are the symptoms? Some frequently asked questions and recommendations for preparedness. Let's begin by defining what it is. This human coronavirus pandemic was officially dubbed COVID-19 by the World Health Organization. It originated in Wuhan, China, and is now spread to over 150 countries, including the United States. It is caused by a single-stranded enveloped RNA virus and is known to be highly contagious, about 2 times that of the seasonal flu. Current statistics show that each COVID-19 patient infects on average 2 to 3 other individuals. Other recent coronavirus outbreaks of familiarity are SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. Transmission is typically by means of airborne droplets through nasal mucosa, causing mild to severe upper respiratory infections that can lead to pneumonia. Symptoms may appear in as few as 2 days or as long as 14 days, with a current average of 5.2 days after exposure, and are similar to those of influenza. 80% of cases are mild, 14% are severe, and 6% become critically ill, with an average mortality rate ranging between 1.4% to 2.3%. As a point of comparison, seasonal flu has a mortality rate of about 0.1%, SARS has a mortality rate of about 10%, MERS 34%, and Ebola 50%. Patients on average will have a fever 83% of the time, a cough 82% of the time, fatigue 44% of the time, and shortness of breath 31% of the time. Now for some frequently asked questions. What about handling products originating from China? Because of the low survivability of this coronavirus on surfaces, there is very low risk of spread from products or packaging that have been shipped over a period of days or weeks at ambient temperatures. Currently, there is no evidence to support transmission of COVID-19 associated with imported goods. Now, what about pets? To date, the CDC has not received any reports of pets or other animals becoming sick with COVID-19. Though it has recently been detected in the mouth of a dog in China, it is believed to be nothing more than expected environmental contamination. At this time, there is no evidence that companion animals can be infected with or spread COVID-19. Is this a difficult microorganism to kill? Though it is highly contagious, COVID-19 is relatively easy to kill on hard non-porous surfaces because it has a fat-soluble outer envelope. Most good quality disinfectants will easily disrupt the outer envelope and destroy COVID-19. However, having said this, we believe strongly that every animal care facility in the country would benefit from also having a liquid surface sterilizer on hand in the event of unexpected outbreaks that put you into panic mode. Sterilizers are a step above routine disinfectants, having a greater and more thorough capacity at killing pathogens than sanitizers or disinfectants by themselves. I'll address this further in the next section when I discuss recommendations for preparedness. Now for our recommendations. In the event of an outbreak and/or to minimize exposure, we would recommend adhering to the following 8 procedures. Number 1, avoid close contact with individuals suffering from acute respiratory infections. Number 2, People with symptoms of acute respiratory infection should stay at home and/or practice cough etiquette. In other words, maintain distances of at least 6 feet from other individuals, cover coughs and sneezes with disposable tissues or clothing, and wash hands. Number 3, frequent hand washing of at least 15 to 20 seconds, especially after direct contact with those who are ill or with their environment, is one of the best things you can do to protect yourself and those around you. Number 4, alcohol-based hand sanitizers are the current World Health Organization recommendation of choice. We would highly recommend facilities have Purell touchless hand sanitizers strategically located throughout their facilities. At AlphaTech Pet, we are an authorized Purell distributor. We would recommend stocking up now while supplies are available. Number 5, refrain from touching eyes, nose, or mouth with potential contaminated hands or gloves. Number 6, perform routine environmental cleaning of workstations, countertops, floors, restrooms, telephones, and even doorknobs. Good cleaning practices alone account for removal of upwards of 90% of microbial contaminants. And in the event of an outbreak, this is where we would recommend also having a liquid surface sterilizer on hand, a specialized product having the capacity to completely sterilize surfaces in 20 minutes. We are an authorized dealer of Sтерicide, the only EPA-approved liquid surface sterilizer on the market. Here, too, we would recommend stocking up on supplies while they are available. Then, in time of need, if it arises, you are prepared. Number 7, cross-train personnel to perform functions so your workplace can continue functioning normally in the event key staff members are absent. And number 8, face masks should be available in the event of potential exposure. We would recommend National Institute for Occupational Safety and Health, NIOSH, certified N95 masks. This concludes the Human Coronavirus Brief. I thank you for your time listening to this presentation. If you have further questions, you can reach us at the number below on this screen or simply go to our website at alphatechpet.com.